To answer the overall question of why should we encourage people to make safe choices, with a target audience of teenagers, first we must answer how drugs are introduced into an adolescent's life. There are many selective pressures that can attribute to drug use in teenagers. The first is school-related stress. In later stages of schooling, it is more common to stay up late or all night studying for exams and completing assignments. This can lead to the early stages of insomnia. Teenagers then seek a way to stay up for hours on end. Through student connections, teenagers can access a wide world of synthetic drugs. With prolonged drug use comes addiction, which can be fatal. Peers can also highly influence a teenager. As they become more independent, peers play a greater role in influencing their thoughts, feelings, and actions. A common example of this is that if someone goes to a party with a close friend who has prior knowledge that there will be alcohol and drugs, it is expected that both people will engage in drug use and alcohol consumption, which is a deadly combination. Parents or close relatives may be taking drugs. The teenager may just assume that this practice is normal. Another family-related influence is separation and divorce between parents. This can lead children to look for something to use to cope with the emotional pain. Personal idols such as singers, writers, actors, and celebrities in their own field who use illicit drugs, drink, and party excessively also affect a teenager's judgment. Often, teenagers just want to be like their idol, although a relatively large portion of underage drug users try them just for fun. But it's all fun and games until somebody gets hurt. Current idols such as Justin Bieber, Megan Fox, Joel Madden, George Michael, and Johnny Depp have either openly or supposedly delved into the drug and alcohol abuse world. Drug abuse comes with many short-term and long-term consequences. For example, drugs are highly addictive, varying jail time along with a permanent record, unlikelihood of employment, financial pressures, violence, homelessness, psychosis, depression, diseases and serious damage to body parts, for example lungs, nose, mouth and internal organs. Drug users and abusers are also more prone to injure themselves or others around them. The most commonly used drug is marijuana, as it is easily accessible and is inexpensive. Marijuana causes paranoia, the increased risk of breathing problems, and strong hallucinations leading to death. Methamphetamine, or meth, comes in second to most common. Usage results in rapid or irregular heart rate, increased blood pressure. It also damages kidneys, lungs, and liver, and can cause psychotic behavior, hallucinations, and stroke. Pregnant women have an increased risk of their babies being born premature, underweight, or stillborn. Behavioral problems can also occur in early childhood. Despite the copious amounts of readily available information on drug use, consequences, and rehabilitation options, including this presentation, people as young as 13 still involve themselves with deadly substances. If children and teenagers do not educate themselves and encourage others to make safe choices, then who will? Drug use can give someone clouded logic, and therefore they are unable to think clearly and make safe and logical decisions. Some associated health risks include HIV/AIDS from dirty syringes and STIs from unsafe and unwanted sex. Unintended pregnancies, drunk driving, road accidents, violence, aggressive behavior, and criminal acts are all practices that have the possibility to negatively involve at least one other person. One of the more accepted medicinal drugs is cannabis, or more commonly known as marijuana. Australia only has one supervised injecting centre despite 69% of Australians supporting the medicinal use of cannabis. Marijuana, also known as pot, in addition to being the most widely used illicit drug in the United States, also has a range of medical benefits. According to NORML, which is a marijuana advocacy group, 21 states and the District of Columbia allow some use of medical marijuana. The drug has been shown through years of scientific research to aid in the treatment of a wide range of clinical applications, including chronic pain, preventing PTSD, stimulating appetite for people with AIDS wasting syndrome, control nausea, relieve intraocular pressure associated with glaucoma, treating opioid dependence, and improving the symptoms of Crohn's disease. Developing research suggests that medicinal marijuana has the possibility to protect the body against select types of malignant tumors and is neuroprotective, resulting in the recovery of a damaged nervous system. People who depend on drugs or abuse drugs often have addictive personalities. By channeling their interests into a safer hobby, such as drawing, running, exercising, or sport, this can draw their minds away from drug use. Having more than one group of friends is also beneficial. Often it is only one group of friends that is involved in illegal practices. Providing information on drugs at a middle school level assists in preventing drug use developing in the teenage years by having information on drugs more readily available at school. A project that could be adapted by schools is to have a young, captivating speaker that will interest students and convince them to listen. After these alarming statistics and information on the truth about drugs, I truly hope you do not at any time in your life decide to take the ultimate risk that could cost you your life.